Question. A nurse and an LPN are working in the labor and birthing clinic. Which intervention should the nurse assign to the LPN and must be done immediately? 1. Complete an initial assessment on a client. 2. Perform a straight catheterization for protein analysis. 3. Increase the oxytocin rate on a laboring client. 4. Recover a mother following a cesarean birth. Answer. Option 2 is correct. Doing straight catheterization is within the scope of practice of a licensed practical nurse. An initial or continuing assessment is the responsibility of the registered nurse. Evaluation by the RN before increasing the IV rate of oxytocin is within the scope of the RN, therefore, it should not be delegated to the LPN. The RN, not the LPN, recovers clients who have had surgery because frequent assessments are needed. Question. A client is induced with oxytocin. The fetal heart rate shows accelerations lasting 15 seconds and exceeding the baseline with fetal movement. What initial intervention associated with this finding should the nurse take? 1. Document fetal well-being. 2. Position the client to her left side. 3. Administer oxygen via face mask at 5 to 10 L per minute. 4. Notify the healthcare provider of the situation. Answer. Option 1 is correct. Accelerations that are episodic and occur during fetal movement demonstrate fetal well-being. Positioning the client to the left side, applying oxygen by face mask, and notifying the healthcare provider are interventions to manage late and variable decelerations indicating the fetus is not tolerating the induction process well. Question. Following an epidural and placement of internal monitors, a client's labor is augmented. Contractions are lasting greater than 90 seconds and occurring every 1.5 minutes. The uterine resting tone is greater than 20 millimeters, mercury with an abnormal fetal heart rate and pattern. Which of the following actions should the nurse take first? 1. Notify the healthcare provider. 2. Position the client to her left side. 3. Turn off the oxytocin infusion. 4. Increase the maintenance IV fluids. Answer. Option 3 is correct. The client is encountering uterine hyperstimulation from oxytocin. The priority intervention is to stop the oxytocin infusion that causes prolonged, frequent contractions, elevated resting tone, and abnormal fetal heart patterns. Next is to position the client to her left side for better perfuse to the mother and fetus, and increase the maintenance of IV fluids to allow available oxygen to be carried to the mother and fetus. A nurse should notify the healthcare provider when all other interventions are initiated. Question. A client is in labor and speaks only Arabic, and his interpreter is busy with an emergency situation. The client was 5 centimeters dilated, 100% effaced, and at 0 station. While working with the client, which of the following responses indicates that the client may be approaching birth? 1. The fetal monitor strip shows late decelerations. 2. The fetal monitor strip shows early decelerations. 3. The client's facial expressions become animated. 4. The client begins to speak to her family in her native language. Answer. Option 2 is correct. Early decelerations are seen as a vagal response when the fetal head is compressed. The fetal heart rate decelerates and inversely mirrors the contraction. This response commonly occurs when the client is 9 to 10 centimeters dilated, or pushing. If communication cannot be facilitated, early decelerations are one indicator that birth may be approaching. Late decelerations may occur at this time but exhibit uteroplacental insufficiency rather than imminent birth. At any time during the labor process, the client may communicate with her family in her native language. The client's facial expressions may change at any point during labor and cannot be used as an indicator of imminent birth. Question. A client is admitted at 31 weeks gestation with contractions every 3 minutes. Her cervix is 1 to 2 centimeters dilated and 75% effaced. Following a 4g bolus dose, IV magnesium sulfate is infused at 2g per hour. How will the nurse know the medication has desired effect? 1. The client will maintain a respiratory rate greater than 11 breaths per minute. 2. Contractions will decrease in frequency, intensity, and duration. 3. The client will maintain blood pressure readings of 120/80 mm Hg. 4. Contractions will increase in frequency, leading to birth. Answer. Option 2 is correct. The desired outcome of magnesium sulfate is the suppression of uterine contraction. It is a smooth muscle relaxant used to slow and stop contractions. Having contractions that lead to birth is not the intended effect of this drug when used for preterm labor. Respirations lower than 11 breaths/min may indicate magnesium sulfate toxicity. Another use of magnesium sulfate is to treat preeclampsia by preventing seizures and lowering maternal blood pressure. However, in this scenario, preterm labor, not preeclampsia, is being treated. Question. A full-term client is admitted for induction of labor. The healthcare provider has assigned a Bishop score of 10. Which drug would the nurse anticipate to be prescribed by the physician to this client? 1. Prostaglandin gel 0.5 mg. 2. Misoprostol 50 mg/GPO. 3. Oxytocin 30 units in 500 ml D5W. 4. Denaprostone 10 mg. Answer. Option 3 is correct. A Bishop score assesses cervical readiness for labor based on 5 factors: cervical softness, cervical effacement, dilation, fetal position, and station. A Bishop score of 5 or greater in a multipara or a score of 8 or greater in a primipara indicates that vaginal birth is probable to result from the induction process. The nurse should expect that labor will be induced using oxytocin because the Bishop score means that the client is 60% to 70% effaced, 3 to 4 centimeters dilated, and in an anterior position. The cervix is soft, and the presenting part is at a -1 to 0 position. Prostaglandin gel, misoprostol, and denaprostone are all cervical ripening agents, and the doses are accurate. However, cervical ripening has already taken place. Question. A client at 32 weeks gestation is admitted in preterm labor. She is given betamethasone 12 mg IM every 24 hours multiplied by 2. What is the desired outcome of this drug therapy? 1. The contractions will end within 24 hours. 2. The client will give birth to a full-term neonate. 3. The neonate will be born with mature lungs. 4. The client will give birth to a neonate without infection. Answer. Option 3 is correct. Betamethasone is a corticosteroid that induces the production of surfactants. The resulting pulmonary maturation causes the fetal lungs to mature more rapidly than usual. Because the lungs are mature, the risk of respiratory distress in neonates is lessened but not eliminated. Betamethasone also decreases the surface tension within the alveoli. Betamethasone has no influence on contractions or carrying the fetus to full term. It also does not control infection. Question. The nurse explains the medication options available for pain relief during labor. The nurse realizes the client needs additional teaching when the client states which of the following. 1. If I have a cesarean, I can have an epidural. 2. Nolbuphine and promethazine will give relief from pain and nausea during early labor. 3. I can have an epidural as soon as I start contracting. 4. If I have an emergency cesarean, I may be put to sleep for the birth. Answer. Option 3 is correct. Typically, a client can have an epidural when she is 3 to 4 centimeters dilated or the active stage of labor has been established. Waiting until the cervix is dilated ensures that the client is in labor, and the epidural is less likely to halt labor contractions. Nolbuphine and promethazine provide relief until the client is about 7 centimeters dilated. If given after this time, narcotics may cause neonatal respiratory depression in the neonate. The majority of clients have an epidural or spinal for a cesarean section. Question. A full-term client is admitted for induction of labor. When admitted, her cervix is 25 zeros. The initial goal is cervical ripening prior to labor induction. Which drug should the physician prescribe to prepare her cervix for induction? 1. Betamethasone. 2. Nolbuphine. 3. Oxytocin. 4. Dilated. Answer. Option 4 is correct. Cervical ripening, or creating a cervix that is soft, anterior, and dilated to 2 to 3 centimeters, must occur before the cervix can efface and dilate with oxytocin. Drugs to achieve this goal include dilated, misoprostol, and prostaglandin E2. Nalbuphine is a narcotic analgesic utilized in early labor and has no influence on the cervix. Betamethasone is a corticosteroid given to mature fetal lungs. Question. A nurse notices repetitive late deceleration on the fetal heart monitor. The priority actions by the nurse include: 1. Notify the provider, explain findings to the patient, and begin pushing. 2. Prepare for birth, reposition patient, and begin pushing. 3. Perform sterile vaginal exam, increase IV fluids, and apply oxygen. 4. Reposition patient, apply oxygen, and increase IV fluids. Answer. Option 4 is correct. Late decelerations on a fetal heart monitor indicate uteroplacental insufficiency. Improving perfusion includes repositioning the patient, oxygen, and IV fluids. A sterile vaginal exam is not indicated at this time. Late decelerations are not expected findings and do not indicate an imminent birth. Question. The physician has performed an amniotomy on a laboring client. Which of the following details must be included in the documentation of this procedure? Select all that apply. 1. Time of rupture. 2. Color and clarity of fluid. 3. Fetal heart rate, effort, and pattern before and after the procedure. 4. Odor and amount of fluid. 5. Size of amnio hook used during the procedure. Answer. Option 1, 2, 3, and 4 are correct. The time of rupture, color, odor, amount, and clarity of amniotic fluid, and fetal heart rate and pattern before and after the procedure are all information that must be documented on the client's record. There is only one size for an amnio hook. Question. Which of the following clients' conditions would be a candidate for induction? 1. Active herpes zoster. 2. Face presentation. 3. Fetus with late decelerations. 4. Preeclampsia. Answer. Option 4 is correct. The client with preeclampsia would be a candidate for the induction process because terminating the pregnancy is the only way to cure preeclampsia. A client with active herpes zoster is a candidate for a cesarean section to prevent the fetus from contracting the virus while passing through the birth canal. The woman with a face presentation will not be able to deliver vaginally due to the extended position of the neck. The client whose fetus exhibits late decelerations without oxytocin would be at greater risk for fetal distress. Late decelerations indicate the fetus does not have enough placental reserves to remain oxygenated during the entire contraction. This client may require a cesarean section. Question. A nurse and a nursing assistant are caring for clients in a labor and birth unit. Which task should the registered nurse delegate to a nursing assistant? 1. Perform a fundal check on a 2-day postpartum client. 2. Remove a fetal monitor and assist a client to the bathroom. 3. Give ibuprofen 800 mg by mouth to a newly postpartum client. 4. Educate a new mother how to bottle feed her infant. Answer. Option 2 is correct. Removing a fetal monitor from a client and assisting her to the bathroom is within the realm of practice of a nursing assistant. Performing a fundal check is an assessment, and education is a responsibility of a registered nurse. A nursing assistant is not allowed to administer medication by any route. Although a nursing assistant can assist a mother with bottle feeding, the formal client education must be conducted and validated by the nurse. Thanks for watching. Subscribe and watch playlist for more videos.